Hello, I'm Dr. Paul Byers, an associate professor in the Department of Preventive Medicine at the University Medical Center and the former state epidemiologist at the Mississippi State Department of Health, and your host for MSMA's Physicians Lounge. Today I'm joined by Mr. Melvin Smith, who is a PhD candidate at the Mississippi State University and is the program manager for the Ag Family Training and Designation course. And today we're going to be talking a little bit about this course to help bridge the trust gap between providers and patients in agricultural families. Welcome, Mr. Smith.
Thank you. I'm really happy to be here.
So tell us a little bit about the Agricultural Family Training and Designation course for healthcare providers.
Yes. So I'll first like to start off, and as you said in that introduction, as far as creating the bridge between the trust gap between providers and patients. The core focus of this program is around access. How can we ensure that agriculture and rural families have the access to the best care that they can get? And as a means to approach this, looking at this from a cultural standpoint and understanding what are the specific demographics, different circumstances and situations that an average agriculture individual may encompass. And creating this course to be able to inform providers who may engage with agricultural families on a day-to-day basis based upon their practice, or may have someone who is traveling great distance to seek care to see them.
So that could be rural providers, or it could be providers who work mainly in urban areas as well.
Exactly, correct. And so creating this course that not only is providing that accessibility and awareness for the providers when they're giving care, but then also thinking of it in a creative way. As you shared, I'm getting my PhD in instructional systems and workforce development. How can we provide this course in an accessible way so that providers can have access to it, not only within a specific area, but more broadly as well?
So it's really a course designed to help providers connect with those rural families, have a better understanding of those rural families and the challenges that they face, whether it's access to care or having to travel great distances for care, but to be able to be more sensitive to the needs of those agricultural families.
Correct.
And so the course is designed for any healthcare provider, for primary care mainly. Is there a specific focus for the providers?
Not in this first iteration, and I'm glad that you asked that question. So this, as mentioned earlier, as the program manager, this is a part of a grant that we have with the U.S. Department of Agriculture. And with this, our first iteration was saying we want to provide it to all providers. It doesn't matter your specialty, location, what have you. However, what we found is that there is a niche for that specificity, and how we can ensure that, though it may be beneficial to wider network, ensuring that it is, I guess you could say, provider specific.
Right. So is there a specificity in the number of rural families or agricultural families that a provider thinks that they see, or if they have interest in broadening this to more of their population, they can access this as well?
It's more about having that common awareness and knowledge for that broader support. One of the things that we wanted to include as a part of this was we were approved for one AMA Category 1 CME credit.
Yeah, that's a great carrot for providers too.
Yes. And one of the reasons why we wanted to provide it to be one CME credit is to also demonstrate that this is something that you can pick up casually. It's not something that's going to take your entire day or half of a day. It's provided through our Canvas platform, through Mississippi State Extension, and providers can log in and log off at their will.
So self-paced.
Exactly.
And they do get that CME credit at the end of that. Do they get another designation as well?
Yes, so we were approved to create a family training designation. We partnered with a credential provider for that as well, to to have that badge, if you will, to put on your LinkedIn, maybe something that you want to share within your social network to show that awareness and accountability for that.
Right. And so what would you think would be the challenges of the rural and agricultural families when reaching out to a provider that this course may help?
Yeah, so a really good example, just to give you like a case study, is you have an individual who works in an agricultural industry, and it is a particular crop season where it's harvest season. This particular individual also may have other comorbidities. They may have hypertension, they may have diabetes, they may have a specific trauma incident that happens right there at work. However, due to the priority of this harvest season, as far as from a financial and economic standpoint, given the potential for access from a transportation perspective, so distances to nearest facility, or a circumstance where this might be a predetermined appointment. And because of all of these other factors, the individual may opt towards staying a little bit longer and may come a little bit later to the appointment, or maybe miss the appointment entirely. And so having these kind of awarenesses when engaging with various different patients from a provider perspective to really form that type of connection with patients from a more contextual backing, if that makes sense.
It does. And so we feel like in the long run, this is going to help providers and patients better connect for the care, better connect for improved health outcomes for those individuals either working in an agricultural setting or living in a rural setting. We feel like that this can help close that gap and build the trust between the patient and the provider.
That's correct.
And so what else should we know about this program and how providers can connect?
Yes, so we are partnering with the Mississippi State Medical Association. We are leveraging a marketing campaign in which we are sharing within the various different communications platforms for individuals to be able to register for the event. It's a very streamlined process. Individuals just share their interest and they will receive a promo code for this course to be free.
So they should go online to share that interest? Is that how they do that?
Correct, correct. And with that, an individual will enroll into the Canvas course. It is 5 modules. And so each module, I would say, would take between 30 to 45 minutes. And so, as I said beforehand, it's self-paced, so an individual can stop and go. We are, however, concluding this particular phase of the project at the end of or middle of August, August 15th. However, if an individual is either interested and would like to contact me to learn more, my email address is mls560@msstate.edu.
Great. And maybe you can repeat that for us.
Yes, mls560@msstate.edu.
Now, is this course free?
Yes,
Fantastic. And so it's available now.
correct.
All right. And so we want to encourage providers who are interested to go ahead and sign up for the course now. And it'll be available at least through August 15th. But if a provider has some additional interest, they can reach out to you and see if we can get the course available for a longer period. Is that correct?
Correct. In fact, just to preface a little bit, or to, I guess you could say, give a little nugget, we are looking at ways to look at the second phase of this. And so as individuals are taking the course or learning interest, they may feel free to reach out to me and share any kind of feedback or comments. I'm more than happy to discuss this program.
So you'll be getting some feedback, obviously, from the providers who take the course more than likely. And what about for the patients? What about for that individual who now sees a doc who's taken this course? Is there some feedback component from them on this?
That's actually a really good question. We haven't engaged with patient populations themselves, we have engaged various different partners within the healthcare space. So we partnered with the Department of Health for the state of Mississippi. We've also partnered with University of Mississippi Medical Center School of Medicine, as well as the Mississippi State extension offices, which are across various different rural communities. And with that, there could be components of individuals who may be potential patients, but what we found is that there's also other provider interests. So, for example, social workers, nurses, other individuals that are a part of that healthcare collaboration team.
And what do we feel like the next phase of this educational module may be?
Yes, great question. So I would say it's about streamlining and, as I always like to say, innovating. So one of the things that we found is, as I shared, 5 modules around 30 to 45 minutes apiece may not be the most accessible for providers who have very busy schedules, various different competing priorities. And though that interest is there, because of the timeline, there's an attrition. And so with that, looking at ways to, I guess you could say, streamline the course so that it is more digestible, maybe something that can be completed within an hour. And then also looking at that component of how can we provide specialty specific courses as well. So looking at, for example, multiple sclerosis and rural and agricultural families who are dealing with those specific instances as well. And so looking and examining at some of those different factors and piloting that as well. And so hopefully we'll still be able to partner with Mississippi State Medical Association and be able to provide that feedback that we get from this first iteration to better serve the providers across the state in our next.
Well, this is very exciting, and we are certainly excited to see what this brings in the future. Is there anything else that we haven't talked about this specific program that you wanted to add?
No, not particularly. I feel that one thing that I really would want to just emphasize is that um, the why for this. And
Yeah, that's great.
to your point earlier around engaging with patient populations and getting that feedback, though that is an aspect that we haven't strategically focused on, that is the intent. And through my various different experiences of program management, that's always the important component, is getting that end user engagement, the always thinking about with the end in mind and working backwards. And so that kind of reverse engineering feedback loop. And so with that patient access and patient care focus, that is the initial why and point that I would always want to drive home.
No, that's an important point. So thank you very much for joining us today. You've been listening to The Physician's Lounge, a podcast from Mississippi State Medical Association. And again, thank you, Mr. Smith.
Thank you. It's been great being here.